President Trump held a news conference and he urged lawmakers to pass a new health care bill.
Any senator who votes against starting debate is telling America that you are fine with the Obamacare nightmare, which is what it is.
Senate Majority Leader Mitch McConnell plans to hold a vote Tuesday, but Republican senators are not yet clear what bill they'll be voting on. Either the Senate designed bill or just an act to repeal the Affordable Care Act. Now, according to the CDC, nearly 2 million Americans were addicted to opioids in 2014, and that number is only growing. Chief political analyst Boris Epshteyn, he's a former Trump campaign senior advisor and White House official, tells us what he thinks should be done in his commentary.
91. That is the number of Americans that die every day from an opioid drug overdose, according to the CDC. 91 people. Those are our friends, relatives, neighbors, co-workers. If that number isn't shocking enough, 12.5 million people misused prescription opioids in 2015, according to the Department of Health and Human Services. The opioid epidemic is not just a rural, suburban, or urban problem. This scourge has creeped into every corner of our United States. Common opioids include prescription medicines such as oxycodone, as well as heroin, an illegal drug. Heroin overdoses have tripled since 2010. Funding for treatment and prevention of opioid addiction has been a key and heated portion of the healthcare reform debate. With rollbacks to Medicaid, senators pushed for more money to be set aside to deal with opioids. The first draft of the Senate healthcare bill included $2 billion in opioids addiction, treatment, and prevention. That number was not enough for many of the moderate GOP senators, such as Senator Capito from West Virginia and Senator Heller from Nevada. It was raised all the way to $45 billion in the latest version of the Senate bill. There is some bipartisan agreement on this issue. Senator Chuck Schumer from New York has also been a vocal advocate for combating the opioid epidemic. On the executive branch side, the Trump administration has instituted a commission on combating drug addiction and opioid crisis. The commission is to provide a comprehensive review and recommendations on how to deal with opioids. The fate of healthcare reform is still up in the air. Regardless of the outcome of the debate, however, the opioid disaster in this country needs to be addressed. A solution should be independent from a repeal and replacement of Obamacare. More funding is vital. Commissions can be successful. However, our government needs to go deeper. They should not only deal with the demand, the addiction, but cut down on the supply of opioids as well. And that's the bottom line.